Shall we do so? Father in heaven, we are so thankful that we have this time together with Dr. Mueller to come to understand more about the loss of life. Lord, this amazing body you have given to us is a complex and amazing body, for it said that we are wonderfully made by you. We ask that this evening, as we dwell more into this connection between the physical and the mental and the spiritual, may you enlighten our minds, speak through Dr. Mueller, so that our hearts will be drawn to come to a better understanding on how you have made us to be this amazing human being that you have given to us. So, Father, may your Holy Spirit speak to us and guide us through this evening. And we pray that, Lord, it will also help us to be drawn closer and closer to you. In Jesus' name I pray. Amen. I'd like to give a short introduction of Dr. Mueller. Born 60 years ago in Romania. That's where he was originally from, and has always grown up in an Adventist church. He moved to Germany at the age of 19 and studied medicine at the University of Freiburg, Germany. And then he finished his residency in 2002 and started his own practice in 2004 in the city of Weinheim, Germany. And I was just amused that he told me that, yes, he's now a physician, but at the same time, he has always wanted to be a pastor. And with this new combination of this medical and also the ministry part of the whole thing is indeed what he has always wanted to be. And indeed, he has found that this combination indeed works so well for him now, being able to teach health and draw people to see God. And he has been doing so since 2008 with giving health lectures throughout the world, and especially about the findings of how the mind affects the body. So I'm indeed very glad that he has flew all the way from Germany to be with us throughout this whole 4-day series. And we ask that we give the attention now to him. Dr. Mueller, the time is yours.
Where I get my exotic fruits. And last night I was amazed to find in the shop mangosteen. Yes, mangosteen is one of my favorite, and I thought they're more expensive here than anywhere else, but they were the cheapest fruit that I've found. I bought others as well, but this was, I was surprised. So I took some of those good things. Now, thank you for the introduction. Thank you for inviting me to come to this beautiful place. It's always a privilege for me to come to a new place, to meet new people, and to see how people think. You see, my own practice, I started in 2004, but back then I had no idea how people think. I just learned that by talking to them. And so I'm always happy to see how you're doing. And as a physician, you always work with the heart of men. I have a good friend that says, you are an ENT and a heart doctor. Because you cannot work with men if you don't work also with his heart, and you mean with his mind, there where he actually lives. Now, yes, I have started 20 years before in my practice, and I had not many ideas to know why my patient got sick. So people come to me with headaches as an ENT physician. They come to me with atopic dermatitis or any kind of disease that you see on the nose there. And then they come with fever, or they come even with foot fungus, even though I'm an ENT and I shouldn't deal with the feet, but I learned to see the whole human being as a whole and not separate it. See, when I once went, I was a medical student and I went with my grandma to an ENT doctor because she had a lump here in her left parotid. And then she complained to the doctor and said, I have so pain in my legs. And then the doctor said, well, I'm not responsible for that. I'm just up here. Oh, that's not a good thing to be a physician, to just be responsible for a certain area, because we have to understand the whole human being, how he works. So when people have a flu or tinnitus, you know, the ringing in the ear. So when I was confronted with these things personally in my practice, you see, when you're in a hospital, you have an attending physician. You have someone to ask, what shall I do with this, or what shall I do with that? But when you get into your own practice, you're all on your own. And now you have to do the job. And as an ENT, you get every age of patients. You don't have just old people or middle age, you have children. It's everything comes to an ENT. And so people come with their different symptoms, and the question is, do I understand what the body communicates with this? I said something sometimes to my patient. I remember one that challenged me because his ears were turning off and on, and he did not know why. And so I told him he should drink more water. So after a while, he came back and said, Doctor, I now drink 3 liters of water and my ears are still not fixed. And then, of course, now as a physician, you're used to change either medication or higher the dose. So maybe 3.5 liters will make it, yes? But then I realized, do I really understand the message of the body? Do I really understand it? And I had to admit, I did not. I had to admit I did not. And so imagine you study many years to become a physician. And then you find yourself in the practice, and you can tell your patient, oh, I know how your disease is called, because we know the names of those things. I know even a prescription that I can write to you down, but I don't know where you have it from. Is that a nice position to be? It's a terrible position to be, to say, I don't know. Now, if I would not be a professional person, I would say, I'm a simple person, I don't know. You see, when you ask me about computers, I will admit that I don't know because I'm not a professional in those things. But to be a professional in health and not knowing what makes one sick was a non-acceptable position in which I was. And I had no other way than to study it for myself. Of course, I had God as my helper, because I went to him and said, if you don't help me, because you made us, only you can help me to understand the human being. Because in the books and in the way I studied it in my university, we did not find out. I was not taught. Look, disease or certain symptoms speak this. Now, meanwhile, it's 20 years later. I'm very thankful that I can offer to my patient to give them an answer for their condition. And that's a beautiful way to be. Now, I cannot fix them, but I can give them the right prescription, so to say, what they have to do in a way to remove the cause. So, what does the body communicate? Does it communicate? Do you understand your body when he speaks to you? Let's see, when he gives the signal that he's missing something. Usually then he gives a signal when something is missing to the system. When something is too much. Last night I was invited to go to eat good food, and sometimes when the food is too good, you don't know what is too, and then you feel it later in the night that it was too much. So your body is telling it to you so that you learn a lesson. Next time when you go, you need to understand, okay, what's the measure? Because the body will tell it to you. Sometimes only after, but even when it comes after, you learn it then. Then he tells you when something was too much. Something is too much or was too much. This is translation. He tells you when it is injured. Yeah, when you injured yourself, you feel something, and you know what to do you? You keep away when you hit yourself with the hammer, or you keep away from that. The body is silent when everything is satisfied. Yes? Then we have no symptom, everything is good. So the first question is, can he give signals by accident? Or are his signals always intentional? That's a very important question, is it? Because in the way we treat sometimes patients, we say, oh, this is by accident happened. I had a young man as a patient. He was 16, a boy, child, and he got a brain tumor on his, I believe, right or left side of the brain. And he went to the doctors, the parents went with him to the neurosurgeon, and they asked him and said, why did he get this tumor? And now this famous neurosurgeon says, bad luck. Bad luck? Is disease bad luck? If it's bad luck, then can we do something about it? If the body speaks accidentally, then how can we do anything about it? Yes, then we remove the tumor, but these people came to me after 1 year, after the tumor was removed, and he grows back. So what do I do with them? Everyone is awake? I hope so. So something, you see, technique, do you think that's a mistake by accident? Yes or no? Is that a signal by accident? Yes or no? Oh, I hear yes and no, so you should get united. So was that signal an accident? Oh, you didn't understand the question. You see, in the technical world, everything you do is absolute. And if there is something that is not working well, it will tell you. So that can never be an accident. It's accidental that it happened, but it's a law that is behind that, where something interferes which is not allowed to interfere. So signals that are in our body and in our, technical world cannot be by accident. Cannot be by accident. So the tumor does not follow an accidental happening, but you need to know what is behind it. So imagine our body will say to us, would give us the feeling of hunger, and we would not understand the message. What would happen with us? If the body would tell us the hunger, do you understand hunger? I think it's the same feeling like in Germany or in Europe or whenever you go. We all have the same feeling when we are hungry. So, and do we know the message? Do you need to learn this in school? Yes or no? No, there's no school for this. You know it. When your body tells you you lack food, then you have to understand the message, because if you don't understand it, what would happen? You would die. Imagine you would not understand that message. And then when you're thirsty, you would not understand that you miss water. Imagine when you're thirsty, you would go to sleep. Would that fix you? You wouldn't do something bad, but you would not supply the need that the body tells you is there and is needed. When you're tired, you would just eat. You know, some people, when they're tired, they eat. Will it fix their sleep? Well, when I did night shifts, and I hated, and I still hate night shifts, I don't like night shifts, in order to stay awake, you eat. Yeah? It gives you some power, but it will not supply your lack of sleep. You need to recuperate it somehow, or you need to get it back. So when you're shortness of breath, you know you lack of oxygen. When you're freezing, you lack of warmth. Yeah? So I turned off my air conditioning in my room because it was too cold. Because I like it to be more warm. So when we are freezing, it's lack of warmth, and when we're sweating, it's too much heat. Now imagine that we would not understand these messages. That's the body language. And we would just not know what to do when he shows us the signal. In all of this, we have no issues. But when the body comes with inflammation, with pain, what does he lack? What does he lack? Because will he come up when everything is fine? No, because the well-being is the normal state. To feel good is the normal state. That's why when people are getting a symptom, they get dizzy, or they're ringing the ear, and they come, and then you need to understand the message. Now, here we have no idea, do we? Do we know what is missing in the body? What does the body language tell you when you're dizzy? What is it? We have seen that all the signals must be intentional, because if they're not intentional, they will not save our lives. So we need to understand, any one of us, because we want to know what our body tells us. Yeah? And that's one of the most important things, because is disease growing or is disease going backwards? What is disease? It's a growing thing. You know, in my 20 years of experience, you know at what age most humans die? And this is my seeing, and it's my observation. It's between 40 and 60. Most people I know die. Only the old people get old. Yeah? But the young people, they are feeble in their very early ages. How much autistic people are growing? Is autism growing or not? It's exploding. HDA, yeah, you know. And depression is growing. Every disease is growing. When I was in medical school, and that's a few years ago, age was a risk factor to get disease, to get sick. You didn't have heart attacks with 15 years old. You didn't have strokes in childhood. At least we didn't learn of those things. Now we have them in childhood. We didn't have psychiatry children. Now they are, with their problems at the age of 6 to 7, they went to the psychiatry hospitals. We had them in the more teenage years. So disease is something that is not in the decreasing, even though we think knowledge is getting better. Actually, disease will only go back when we have understood the message of the body, what it tells. And I am so glad that we can know it. And that's why I'm traveling wherever I'm called to go, because it's the most important thing to understand, what do you miss? What is the body missing when you are sick? So how can we find out what the body communicates when we are sick? Do we need to know something, or do we just have to guess? Do we need to know something? For sure. What do we need to know? What would be that thing that is essential to know, to understand? First of all, we would need to know the nature of man, would we? We would need to know what his needs are there. Where does he need, has to supply its needs. Because not knowing where the needs, what needs are there, then we don't know what the body tells us when he lacks something. And then we need to know the law that governs our lives. I have this general title of my presentations, The Law of Life, because I understood that things work by law. They don't work by accident. They don't work by chance. Everything that works by law. And the natural law must be understood. But I must confess to you that when I started back in 2004, I did not know neither the human nature, neither the law that governs life. So I had to find it out. And the first question was, do I know the human being? How can you repair a computer if you don't know how it works? Can you repair that? Would you ever go with your car to a mechanic that has no idea about how the car works? Would you go or not? No, you would not go. Now, we all suppose the physician knows. And yes, he has a lot of knowledge. But there was something essential that I missed, and that I believe is missing generally in our medical science. And that is to know the human being, to know the object we were working with. So how did I come to find out the human being? And I did it without, in a simple way. I put the patient, his age, in a timeline, and I put on one side his physical history. So I started with the list of physical complaints. Headache. Since when do you have headache? Which side? When does it appear? The details. Neck tensions. Since when do you have neck tensions? When did your ringing in the ear start? Which ear? How does it is? How is it? A low frequency or high frequency? Dizziness. When did it come? How does it work? And all those things. So you take all the details of the patient and put it in a timeline. Now, many people who come to my practice are surprised when I go beyond my own field. And just the other day, I had an 80-year-old lady who came to me because since 2 days, her right ear is making certain noises. It says it's pop, gets some like an explosion is in my ear. It comes. And so these are symptoms. Usually doctors don't know what to do with it. But it's a body sign, it's a body language. And as I understand what she says, I say, okay, as a physician, I need to know what the body tells her so that I can tell her what she lacks. So I didn't ask her only about her other physical symptoms. I asked her about her surgical interventions, when they take place. She had not much of her. She was quite healthy at the age of 80 years old, and I asked her about miscarriages and all those things. I made a very plain history of the body. But now I don't stop with her here. Of course, I do the hearing test, I do the needed consultations, but then I start with the mental history. And I ask them about relationships between their parents, relationship with her mother, a relationship with father, spouse, children, relationship in marriage, divorce, death of loved ones, so events in your life. And then when did they take place? And then you put them all in the timeline here on the other side to see where they fit in time. And then you put employment conditions and occupations, unemployment, and of course, special events, traumas, abuses, and all those things you put there that you lived through. And then you put them there, and I did this at the beginning, and if every physician would do this, they would see the same thing I saw. What did I see? What did I see? Didn't take me, I don't know, was it 10 or 100 patients? I did it right now in tens, I don't know how many, 10,000 patients I see. Only in my practice I have seen 30,000 patients. But then where I travel since 15 years, I have seen many other places. So what did I see? I see in the body the reflection of the thoughts. And I was so amazed. I went home every day telling my teenage children, we have raised 6 foster children, and 3 were still at home, and they were at the age of 14, 16, and 18. And I told them the story. I said, look, the lady has an infection of her ear, and the history shows that the infection came after her husband was put into the hospital. The next day, her infection came. And then the other stories, the vocal cord got paralyzed after she heard that her husband betrayed her. So that was you had a symptom and you had a story. And I told that to my teenagers. How did they react? Did they say, you're a good doctor? They questioned it, and I will show you how they question it. But after 2.5 years, it took me 2.5 years, I was convinced that the body just is a mirror of what the person thinks. Now I asked this 80-year-old lady about her mental issues, and her physical diseases were beautifully shown up the way her history was. Now I couldn't go to all the history, but since the symptom was recent, it must be a recent thing. Yeah, it must be something that is acute there. And so I asked her, and she told me that 2 years ago, her husband passed away. And that was bringing up to her hypertension. But what was in my field, the right side of the ear, and we will see why it's right and left and so on, you know what happened? And it's not my first case that I see this. Her cat passed away. Do you have cats here in Singapore? You have pets at home? Is there a bond that you bind to them? Yes? This cat was now sick for 3 months, and they didn't find anything out, and since it's a cat that can go out, it's not living in the house just with her, she said the cat left 2 days ago, and I don't know where it gone. Probably it gone somewhere to hide and pass away. That is known that cats are doing that. They want to die, don't die. Yes, they go somewhere to hide. So, would you bring the death of her cat together with her noise in the ear? Would you? As a normal physician, you would never do that. You would think that is out of the world. But when I asked her his history, she started weeping. And she said, I thought I came to the ENT doctor, not to the psychiatrist or the psychologist. Well, I said that a physician, and this is my point, has to know everything. Do you like those physicians? He has to know the whole human being. Because we are one. We are not put in parts. And I think specializing is beneficial if it's about surgeries, it's about intervention, and you're specialized in this and this. So that's a technical thing where specialty might be beneficial. But in the way to see the whole human being as a physician, every physician should know the basics and know what the body tells you as a whole, not just as a, staying in your field and then remain in your field. So the lady was quite surprised that I asked her about her thoughts, and I confirmed to her, I said, you need to change the way you think, as well to the death of your husband, as well as to the death of your cat. But you see, she's alone. I can't remember exactly if she has 2 children, but they don't live with her. So now, you see, when the husband passed away, she still had her cat. And I tell you, my wife has a cat that takes my place when I'm not there. So I don't know what she will mourn more, me or the cat, because they're just very good together. And so there is a bond there that happens, and we need to know why that bond happens. So it was an amazing thing to see, and I now did it in so many cases where I always see the pattern. So going from the law we know that our life is dependent on things. Life is conditioned by our needs. We cannot live without satisfying the needs that life expects. And if all needs are fulfilled, we have normal function. Health is there, because we are inside the law, the range where we have to have all our needs fulfilled. And outside, when we go beyond that line and the needs are not fulfilled enough, the body brings a symptom. It speaks to us. And if you don't understand the message, then we might go further and end up in death, while we could have come back from here, because this is the tolerance place, we could go back from here into the normal range. Yeah? So that's why it's so important to understand the message of the body when it tells you when you get sick. So how many kind of needs do we have? Now, in order to understand the body's language, you need to know the body's needs. Yes? So we all know that we need physical need, chemistry, oxygen, water, warmth. And we saw already that our body, when we get to the edge of the range where we have to be, brings a reaction. And it's easy to see when we're freezing, we know it's too low the temperature. And when we are sweating, we know it's too high the temperature. Do we do that on intention? It just comes because it's a law there. The body is set for 37 degrees Celsius. And he has a tolerance. But when that tolerance is over, then he must bring the symptoms. And he brings it quite fast so that we can adjust to do it. But now, when you have the noise in the ear, which is not perceptible, when you have a sudden hearing loss, or a dizziness, or even cancer, what is the body telling you? And if it tells us something, then we need to find it out. And what did I find out in my inquiry? What is the story? What is the content of our mental issues? What is in our mind? What's the needs that we have in our mind? Why is this lady suffering after she's suffering that she says, my cat has passed away, but I don't know where she is. She went to the neighbors. She would have loved to bury her or whatever. But what is in her mind? Why is she sad? What is she missing? What is in her mind? What's the center of her mind? You see, I didn't know this. I came to it in my practice. You know what is the center of all stories that I heard in my life? What's the center of it? It's love. It's all about love. But I never learned anything in medical school about love, did you? I know there are some physicians here. Did we do a course about love in medical school? Yes or no? There is none. And I realized in my practice that all the issues my patient had coming to me with their physical symptoms, looking to their thought process, I realized that the issue was a non-physical element. Because I ask sometimes my patient and even the audience, is love physical? Or is it just spiritual? What is love? What is righteousness? What is liberty? What is security? You know, some people come up and say, it's physical. I said, oh, come please and give me the formula. Because if I have the formula, I can treat how many of my patients? All of them. If they come to me and said, oh, I am so sad because someone passed away or because the divorce or whatever happens, I said, no worries, I have some drops of love. You take that in and your mourning for your husband stops. Is that good? You just give them that what they need. If they have a lack of righteousness, you have a drops of righteousness. You fill it up, and how do you feel? Is that possible? You see, one of the things that today are very, very growing is security. That is fear. Fear is the lack of security. How do we satisfy that need? Because we need to satisfy it. It has to be clear, and that need is just in our thoughts. It's just here, it's imaginary. It cannot be grasped by chemistry, by formulas. So I stand there in my practice, having a physical issue and a spiritual lack. And the question is, what is the body telling me? The spiritual needs have no limit. You can never have enough love. So some people come and say, my mother loves me too much. That means she doesn't love her because she controls her. That's love of the mother, you know? I don't know how it is here, but mothers are very loving, and they believe love and control comes together, yes? It's very hard for mothers to give up control because they confound love and control. So there is no limit on this side, because you can never have half of love. You can never have 99% security. If you have 99% security, how much security do you have? None. I tell you a story of my patient. She had a otosclerosis. That's the medical term. There's one of the ossicles that gets to not be moved anymore because it grows a kind of calc is building around, and then the ossicle doesn't move anymore so well. And if you go for surgery, you can have surgery, and the risk of remaining deaf after the surgery is 1%. High risk or low risk? You all would say it is low risk. But for each patient, how great is the risk? You see, this is the trick of the statistics. Because she thought 1 in 100 get deaf at this surgery, she will be okay. But if she's the one, then what happens? Then the risk is 100%. And she was the one. And she was suffering now depression because she said, I would have never done it, but now it's done. Because you can injure that very thin layer, and then when the fluid comes out of the cochlea, you're deaf. Nothing works anymore. So, you see, 99% security is no security in reality. Yeah? And our mind knows that. But we just go into doing things because we believe they're going to come out well. So now the question is, how many body reactions do we have to show the lack of love in our life? And I tell you this result, and it might shock you or amaze you, but what I came to observe in 20 years is disease in all its forms shows to me the lack of love or of righteousness, that is, of the spiritual element that our minds feed on. Now, understanding that, for me, it makes sense. Now let's go a little bit deeper. Relationships are just in our mind. Can thought about them cause disease? What do you think? That's why I had to start my study about thoughts. What are thoughts? Have you ever thought what thoughts are? Are it your thoughts or not your thoughts? What are thoughts? We should know what are thoughts, should we? Where do they come from? Where do they come from? Would it be important to know the origin of the thought? If thought is so important, then where is the thought process starting? Would that be good to know? Because the thought process must have a starting point. And to know that would bring you into the control of your thinking. Most of my patients believe that they cannot control their thoughts. But if you cannot control your thoughts, who's going to suffer? Yeah? And then another question, and this is very, very important. What can they do? Let me know this answer. What can thoughts do? Or better, to ask the questions the other way around. What can they not do? How many things in your life you do by your thoughts? How many things? How many things in your life you do by your thoughts? All of them. I heard many, so I didn't jump on that. Because imagine everything we do is the result of a thought. Now, should that have an importance for us or not? Yes or no? So why do we don't have any emphasis in the medical work on the thought? Why not? When everything we do is the result of a thought. I'm very glad because I learned all those things from my patient. And I had one day, he was, I think, 18 years old, and he came because both of his parotid glands were swollen. The left one was bigger than the right one swollen. And since I looked not just to his parotid, so his head, I said, what do you have else in your body? And he said, ingrown nail on the thumb of your foot. Now, what do you guess? Which thumb, the nail of which thumb was more ingrown in his body? The right side or the left side? Now, I don't want to challenge you too much, but you know that what is on this side is still governed from the same part of the brain. And then the nerves crosses and they go down to the other side. So there was a beautiful picture. You have a big swollen parotid on your left side and a stronger ingrown nail on your right thumb. You have a little swelling of this side and you have the same on your left thumb. Would any physician bring those things together? And I was still at the beginning when I had this patient and I asked him the question, do you think your thoughts are making that? What was his answer? No. And if you go and ask someone, can your thought do that? They will say, no, but how can you prove it that not? Because I tell my patient, I say, you can never move anything of your body without your thought first. How can you say that your thought cannot do anything else as well? How can you say that? So, my attention went from the body to the mind, to the thought process. Because I realized the issue that men have is not in the externals, because they know when they're hungry, they know when they're that, but when something happens that is connected to their relationship, that is connected to their spiritual need of love or righteousness and that, they have no solution for that. And then they put a pressure in their body. So everything you see around yourself is the result of a thought. Everything. Nothing comes into existence except by thought. So this is why thoughts are all powerful. Because everything comes out by thoughts. Before you can do anything with your body, you must think and you must decide to do those things. So what is their role in health? What role do they play in health? Now imagine we would find out that thoughts make one sick. What would be our health approach? Would we build hospitals or schools? What would we build? Where would we put the emphasis? Education. We need to show them how things work. Because in which school you go, and the child is taught his thought process, how he takes decisions, how things work physiologically, and how it impacts his body. Any school that we have on the earth for that? I don't know of none. And that's amazing. I'm still amazed after 20 years of my practice to see that the essence of life, which is love, is totally neglected when it comes to the sickness of the body. Isn't that amazing? It's just, I'm amazed, and I know that we have an enemy, and the enemy succeeded to take that first need that man has away from him. Not that he cannot have it, but it is eclipsed out of his mind, so whenever he has something physical, he thinks it must be physical, the cause. And not realizing that it's not the case. So I didn't have an answer to these questions 20 years ago, but I have an answer today. And we could have a week or a month just studying these 3 or 5 things, understanding how things work. Now going home, I said, my teenage children challenged me. They said, how can you prove your observation to be true? I said, look, this is the story. No, I just started. This is a story. And they said, how can you prove? Because everyone has issues in life. Do you have issues in your life? Yes or no? Yes, everyone has issues. And how can you bring the issue of life together with the symptom of your body? So observation is subjective. How can observation become objective? How can it? Because if it remains subjective, it's my observation and you have to believe me. My patient has to believe me if I cannot prove him by objective things that things are like they are. If I would come to my patient and say, look, you have to believe me because it's my observation, then that's not science. That's faith, that's belief, that's religion. And medical doctors do not have to do with religion, they have to have scientific things, Things must be absolute. So in all areas of nature, we find things in the physical, in the life world, we find things that are changeable and things that are unchangeable. The changeable things is the appearance, the size, the color, and so on. Can you rely on them? I mean, they are changeable. You cannot orient so well on changeable things. But there is the unchangeable. The law by which everything functions is unchangeable. The structure as something is built cannot be changed. The functions are absolute. The basic needs for that what is needed to function cannot be changed, and the source from where the needs are fulfilled cannot be changed. Do you need oxygen? Yes. Can you go and take the oxygen from the water? Just jump into the water and take a deep breath and see if it satisfies your need. Will it work? Not at all. Because the source where you have to take your oxygen is set by the one that created. Always the source is set. You cannot switch it. You cannot say, I take it from here or from there. The source from where the needs are fulfilled are absolute. So decisive is for us to know the unchangeable. Now, before I started my practice, I didn't know of this, and I had to find out what is that I can prove first for myself, because it must be provable, and then to my patient, that the disease is an issue of love. It's a lack of love. So, to answer questions, we need references. We need a measure. So we always need two kinds of information. If we have time tomorrow or so on, we will study that even deeper. But when we have a question, we have to put that on one plate of the scale. And in order to have the answer of this, we need another information as well. Now let's see, if you want to know how much is a kilo of banana,